The entire healthcare system is broken. Recently, we've witnessed the assassination of the CEO of United Healthcare, and the craziest thing is many people have cheered and celebrated that assassination. Call me old-fashioned, but I don't celebrate the assassination of an innocent man who's part of a broken system. I don't celebrate the assassination of a scapegoat, but many people do. You can find them on Blue Sky, apparently. That's where they like to go, because that's where their political ideology fits best. Well, I have an article out now in Sensible Medicine, and it really is about the entire healthcare system, which is profoundly broken. There's no question it's a broken system. We spend 20% of GDP on healthcare. Our outcomes are worse than any comparable peer nation. No other peer nation spends as much as we do. We just spend. Our paychecks get smaller and smaller. We're drowning on premiums, and we're not getting healthcare that actually makes us healthier, makes us live better or longer. Ironically, the solution to good health is probably much more about diet and lifestyle and things outside of healthcare, schools, education, nutrition. Those are the things we don't want to pay for. We want to pay for unproven medical devices once you already have a problem that's incurable. That's the American way. Now, who's at fault? I see a lot of people celebrate this CEO assassin. I see someplace in Brooklyn has got his poster. They're making a martyr out of this guy. You should not make a martyr out of an assassin who basically killed an innocent man who is a scapegoat for a broader problem. This is a terrible person who should spend his life in prison, okay? He's not any hero. And who's at fault? This is what people don't capture. Every single player in American healthcare is at fault. There is no single villain. The whole system is broken. Let's run through them. The pharmaceutical industry. They're profoundly broken. Their incentive is not to make curative products. Of course, they sometimes do that. They stumble upon those really great products, but their incentive is to make a product that you can get to the market and you can sell. And so there are many, many marginal Me Too or even uncertain products that make it to the market, products that are probably worse than products we already have. They are trying to get those products into the hands of doctors and patients, and they will do anything, including illegal marketing. They've paid all these fines. They will do anything to advance that agenda. So they're at fault. The PBMs, the pharmaceutical managers, they are also at fault. They're like a useless middleman that extracts their fee. The FDA. The FDA is also at fault. The FDA is not committed to the best interests of the American people. The FDA is committed to the best interests of the people who pressure the FDA. And that's politicians who are heavily leveraged by the American healthcare industry. That's the prospect of future employment in the healthcare sector. The people at the FDA's goal is not to approve products that have only shown that they're safe and effective, which is their mandate. It's to approve products that have the appearance of safety and efficacy, that jump through certain hurdles, as long as those hurdles ensure high profits so that they someday can go work for those companies. That's the revolving door politics. We see that a lot with Peter Marks and Bob Califf. They are pushing Paxlovid in populations that's never shown benefit. The FDA could demand Pfizer run appropriate studies. They choose not to. Insurance companies. Make no mistake, insurance companies are deeply at fault in this current system. People like to complain about the denials, and don't get me wrong, those denials are wrong. They deny a lot of necessary care. But they also fund a lot of unnecessary care. A lot of useless things make it through their processes. They're paying for useless things. And here's the thing people don't recognize. Their incentive is actually not in the long haul to cut costs. Their incentive is to grow healthcare spending. You see, the Affordable Care Act limited the amount of profit they can take on revenue at 20%. And if you limit the amount of profit you can take on revenue, the only way to make more profit is to increase the amount of money that flows through the system. Let me give you an analogy. If we go out to eat pizza and I say, you can only eat 20% of the pizza and you're really hungry, what size pizza should I get? Your answer is going to be extra large. And that's what they want. They want healthcare spending to be 30%, 40%, 50% of GDP. They want it to be extra large. They just need to get there slowly so that they can march lockstep with their competitors, so that they can keep their premiums competitive for the time being. But don't get me wrong, they have no long-term cost containment growth. That's not one of their incentives. And then doctors. Everyone wants to pretend doctors exist on some pedestal. If you actually pull the last 100 charts of many physicians, you will find lots of medicine that's unproven, that makes no sense, that defies logic. If you even have their own peers judge it, their peers may judge them as crazy. I constantly see medicine that's completely Hail Mary, batshit crazy medicine. I don't have a problem with people attempting unproven things in last lines and in desperate times. But I see crazy medicine for people with curable conditions, for people who have many proven options. But I guess my concern is, how can we live in a world where society is taxed to pay for these unproven things? Like, I'm comfortable with you spending your own money on unproven healthcare, but I'm not comfortable with us taxing the plumber, the school bus driver to pay for someone else's unproven medicine. I think people can debate whether or not healthcare is a human right. But anyone who believes that healthcare is a human right, they can't believe that any single thing you want is a human right. They must believe that healthcare that's cost-effective and evidence-based is a human right. But surely, if you just want to get an echo every day just for funsies, society shouldn't pay for that, right? So we all agree there's something that goes too far. But where is that? How can we figure that out? Well, we need evidence, prospective evidence, typically randomized evidence. To me, one of the failures of the pandemic was that we didn't enforce any standard of evidence. We just pushed things willy-nilly, and that's why so many bad practices came through. And we've got a new paper on that coming soon. And then hospitals. Hospitals are a huge villain in this story because hospitals are predatory. They suck up capital. They're like a parasite that's sucking the money from the region. Hospitals like UPMC, it's like a $4 billion enterprise buying up local practices. It's not an academic center. It's not a scholarly place. It's a predatory monster that's trying to maximize the cash flow. And their profit on revenue is not capped. So they can have 40% profit margins. They can build gilded and glass buildings to do whatever nonsense they're doing for their administrations, while the clinical wards are often decrepit. And then they can keep growing and growing and growing. So I think they're also part of the problem. Every single player in the system is part of the problem. So when I see someone like this crazy schizophrenic guy assassinate the CEO of an insurance company, who's actually kind of the CEO of a subsidiary to a broader insurance company, by the way, I think that that's pretty much not going to solve anything. It's pretty horrible that he did that to an innocent guy who's being scapegoated for this complete systemic failure. But what's worse to me is that there are actually people cheering him on. I think there's a survey that came out of Pew. It said 10% of people actually have a favorable view of the assassin. That's so bad. That's because the public has been misinformed about the root cause of healthcare dysfunction. Of course, insurance companies are at fault. They deny some things that are proven. But sometimes they're denying something that's completely crazy. We need to also acknowledge that sometimes doctors are recommending crazy things. Go back and watch my video about the Vanderbilt physicians who are recommending a double lung transplant for someone with stage 4 lung cancer, something that should only be attempted in a clinical trial or on the island of Dr. Moreau. It shouldn't be attempted just willy-nilly. And certainly, how can you tax a plumber to pay for this? It's an investigational thing. You need to raise NIH funds to run that. Good luck raising that under Jay. I wonder how Jay will think about that. Okay, so my first point of this video is to discuss that the healthcare system is profoundly broken. It's fractured in every single way. Every single person is at fault. I think you can even be at fault for having an ill understanding of where it's broken. And I think I recommend my article in Sensible Medicine called "The Entire Healthcare System is Broken, Not Just Health Insurance Companies. It is not heroic to assassinate insurance CEOs." And the subtitle, "The assassin is an asshole that's going to die in prison," end quote, as John Fetterman says. I like that Fetterman quote. I think that's actually spot on. Okay, the next thing I wanted to talk about was a little bit about the Samoa measles outbreak. You know, I was reading about the Samoa measles outbreak because people kept asking me. They said, you've done all these points of view about RFK Jr., what he got right and what he got wrong. You're not talking about all the damage he did in Samoa. So let me just introduce some facts. This is from a loosely fact-based source called Wikipedia. Okay, but I mean, it's based on news stories. Okay. And I say loosely fact-based because on some stories, Wikipedia has a huge, clearly liberal bias. The 2019 Samoa measles outbreak began in 2019. There were 5,700 cases of measles and 83 deaths out of a population of 200,000. 3% of the population was infected. How did it all get started? Well, it turns out measles first arrived in Samoa in 1893, carried by a steamer from New Zealand. So that's very interesting that they actually never had measles historically for millennia. It was only brought in by colonization. On July 2018, on the east coast of Samoa, 2 12-month-old children died after receiving MMR vaccinations. The cause of death was an incorrect preparation of the vaccine by 2 nurses who mixed vaccine powder with expired anesthetic. I think it was a muscle relaxant instead of like a saline. So that's what happened. 2 deaths, okay, in July 2018. And they say vaccination rates fell from 74% in 2017 to 34% in 2018. So there are 2 deaths on an island where rumor will run rampant, and then vaccination rates fall 40%. Do I believe that's plausible? Yeah, absolutely. That even though those 2 deaths were preventable, and even though it's unlikely that they would occur again because probably not another nurse that's going to mix up those 2 vials again, certainly not in the aftermath, people will respond in sort of a hysterical way, and they will naturally be reluctant to participate in this program if it just killed 2 babies. So if you ask me, the root failure here was what kind of system was in place that allowed someone to accidentally mix up an anesthetic rather than saline. I think that would where I would say the root cause of the problem is. The response from the public, I think, is probably completely natural. But then here's where they try to tie in RFK. On June 2019, RFK visited Samoa to meet with local anti-vaccine advocates, including so-and-so and so-and-so. I don't know who these are, and the prime minister, and he campaigned against the vaccine. And then, of course, there was the outbreak. Okay, the outbreak began in August 2019. So they want to blame him for the outbreak. Okay, well, I don't know what he said. I don't know what he did. And I certainly think that probably the best public health messaging in the aftermath of the screw-up would probably be, we have completely solved this problem. This is still an important vaccine-preventable illness, et cetera, et cetera. But I think it's a stretch to blame a guy for it because he just walked in a month before the vaccine rates were already plummeting. And then they blame anti-vaccine advocates. Of course, there's going to be a lot of people who take a tragedy like this and exploit. You know, you remember that a few years ago, Chipotle had an outbreak of some foodborne E. coli. What happened? Chipotle revenue was rock bottom thereafter. Chipotle kept trying to clean up their supply chain. Who are you going to blame for that? Are you going to blame RFK Jr. because he said Chipotle is unsafe to eat? Or are you going to blame somebody on Twitter who said Chipotle is dangerous? No, to some degree, people reacted irrationally to that story because I continue to eat at Chipotle because I like Chipotle and I knew that the risk was still infinitesimal. Okay, so this is the phenomenon that happens in societies when there is something very bad that happens from something that's typically safe. People will react extremely dramatically. Now, what he said when he said it, I think it's very difficult for you to try to pin the whole thing on him. There's probably a huge anti-vaccine sentiment in an island nation with low levels of education that's only had the virus introduced by Western people just within the last few hundred years. I think there would be naturally a huge backlash. And then it looks like the vaccine rates declined the year before he got there. So what is we talking about here? I mean, you want to blame it all on him? I don't know what you're trying to do here. Okay, did he help the cause? I don't know. Did he hurt the cause? I don't know. But I do think the story cannot be so simply as that he came in and he's completely responsible. I just think that just can't be the correct narrative. I don't know all the details. I'm willing to learn more about the details, but just the timeline, the basic timeline, doesn't make sense to me. And I didn't want to read about this, but the moment I read about it, I was like, okay, what are you telling me? You've framed it a certain way. I would say that the bigger screw-up is the original screw-up. Killing 2 kids who are completely healthy from the vaccine is kind of a screw-up, and they shouldn't have mixed those 2 vials. That does happen. And then in the aftermath of that, it is natural for everyone to overreact. In fact, if you actually look at most hospitals and the operating procedures that we have for so many things, don't you see it's also sort of an overreaction to things that happened in the past? I mean, one bad thing happens, and now every single time we got to do 25 checklists and all this bureaucracy. That is what happens. And actually, when people heard Chipotle had some food poisoning, nobody ate at Chipotle. I mean, Chipotle stock went down and the sales went down far beyond the actual risk of food poisoning. That's why I ended up getting that sweet deal on the burrito bowl. But you know what I mean? Like, I just don't know. And then he wanders in a year later. All right, well, and then there's like 1 million people who are not, or who are critical of vaccines who would want to seize upon such an opportunity. Meanwhile, the policy question is, what do you want to do about this going forward? What do you think he's going to do as HHS secretary? I still don't think he's going to do that much. And I think you have to take his energies and channel it into the actual problem, which is that we don't have a good vaccine surveillance system. And we could develop a better surveillance system if anyone actually wanted to do that. But guess what? None of the companies would want to do that because it's only going to poison their market share. And this guy might actually be able to do that. So take his energy and move it in the right direction is what I always say. And also, people did vote for him because they knew he was going to do the job. I mean, I hear all these things people tell me, and it just doesn't make a lot of sense to me. It doesn't make a lot of sense to me. Blue sky. I just think that it's such a joke. People on my team were talking about blue sky, and they said that One thing people like to say there is it's such a civil place to have dialogue. Well, I think Jesse Singal doesn't think it's civil. He has a nice article in the Free Press this week talking about how he received many, many death threats there for his point of views on transgendered medicine, which fall out of favor because I think he likes evidence and science, and a lot of the prevailing views in that are mostly based on ideology. And he didn't do so well on Blue Sky. To me, when people say blue sky civil, they just mean they like to go to a place where people don't disagree, that they can be further in their bubble. And I guess I don't have a problem with that, actually. Sometimes people say, like, debates are good. I think debates are good if they're structured and you have people who are good debaters who are arguing at the top of the debate. But just this constant churning on social media, maybe it is good that you can lump these lunatics outside on their blue sky and you can keep Twitter, which now actually probably is closer to the center of America and American beliefs by having removed the oversampling of the far left. Twitter is probably not much more close to mainstream, and I think there's some data to show that that's true. So to me, that's not a bad thing, that Twitter would look more like the actual town square instead of oversampling from some political ideologies. Well, those were most of my thoughts. I've been busy. Part of the reason why I'm dressed like this is not just because my mother complains when she sees me in a t-shirt, although she complains. It's also because I've been working in the hospital doing the hard work of actual clinical medicine, which doesn't have all the excitement of these topical issues, and of which you can never tell all the stories. But there's lots of interesting things that happen in the clinic, and I think that there's still good medicine that does occur. But there's a lot of bad medicine. I think that's what I mean. If you actually think about what we're doing, there's lots of unnecessary and unproven and pointless tests. There's lots of decisions that our doctors are making without consulting with patients. There's lots of things we don't know and we don't admit that we don't know. And there's lots of people doing things because they were taught to do it and they actually can't explain why they're doing what they're doing. And they don't have good explanations. And to me, it could be improved. If I were in charge of something like, say, medical education, I might say, we should try to train doctors who are better at taking care of patients. But that's fallen out of favor. These days, you got to train doctors to encourage patients to vote, to lobby for gun control, to fix climate change and carbon emissions. That's apparently something that's a top priority. You need the doctor to make sure to know how much carbon it is emitted by each chemo regimen. We need doctors to basically be, far left politicians. That's what most med schools are going in that direction. Whether or not they want to talk for 5 days about whether or not race should be included in the GFR equation. They don't want to talk about renal dosing of medications, which people don't seem to get right all the time. They don't want to talk about anything practical, and they want to keep adding. I see a proposal to teach doctors about personal finance, teach doctors about health policy, teach doctors about writing to your congressman. How about teaching doctors how to prescribe medicines appropriately and not inappropriately? That's what I'm interested in doing, and teaching doctors that small task. Using medications appropriately, to know the data behind the medications, to know the study results. That's my simple, humble interest. That's what I've been working on these last few weeks. On wards, on the service. All right. Well, I think that's everything I had listed on my little list. I've got another piece coming out on Vinay Prasad's Observations and Thoughts, my Substack, about how to, why medicine gets things wrong, like 5 sorts of fallacies I see. I'm excited about the new year, FDA with Marty, NIH with Jay. I'm excited. I think it's good times, very good times. Lots of important changes are going to come. So it's a good time. All right. If you like this video, you know what to do. Oh, a few more things. I have some lectures that I'm going to keep putting out. I gave a lot of lectures recently. I think I've got some more from WashU that I want to put out that are really nice. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. Follow me on Instagram. Follow me on Substack. And until next time.